200. That's WIN to 200 200. You'll get confirmation text and info. Standard data and message rates apply in this nationwide contest. Beyond Reason Radio.
So apparently Obama endorsed Joe Biden. Man, he was really going out on a limb today.
Boy, I'll say.
Wow. Man, really taking a chance for that endorsement.
They probably had some polls come back and say, now's the time,
When there's no one else left, now's the time.
Decisive.
I got Mr. Decisive. That show, that Barack Obama. Oh, Lord. Apparently he also bashed Fox News.
Really?
Or whatever in the cut.
I find that hard to believe.
Well, I know only Trump bashes media outlets. Obama was Mr. Civility. Never called out media outlets. It's only Trump who's threatening the First Amendment, is what we hear. This is Beyond Reason Radio. I'm your host, Michael Yaffe, the voice of reason in a world that is beyond reason. We are on till 8 p.m. tonight right here on News Radio WFLA Orlando. Lots to get to. Of course, it's going to be mostly coronavirus related.
Is that still going on?
Apparently. I think people are already getting sick of it, as you were talking
I think
about.
a lot of people are getting tired of being cooped up in the house. You can only do so many puzzles and play so many family games. And
so many puzzles. There's only so many shows on Netflix that you really care to watch.
That's right. For the second time.
Only so many reruns of the 2001 championship in the NBA, the finals.
I'm binging on Cheers right now.
Are you real? I love that's a great show.
Sure.
So what you have to do after Cheers is then binge Frasier.
I've done that.
Yeah, both great shows.
I'd love to find Hogan's Heroes, but there's none around. I
Really?
can't find them yet. They're on some of the nostalgia TV channels, but I can't find them online anywhere.
Okay. So the voice you heard in there is Tom Benson once again. How are you, Tom?
I'm doing fine. Is it warm enough for you?
Oh my gosh. I walked out of the house yesterday. I walk out at 4:30 in the morning for the morning show.
Sure.
And I couldn't believe how hot it was at 4:30 in the morning.
It's like late July and August without the benefit of afternoon thunderstorms.
Yeah.
But there's some rain coming on Thursday. It's going to be an all-day rain, supposedly. 97% chance and much cooler.
Yep. So where do I want to begin? Do I really need to talk about Obama endorsing Biden? Is that really even news?
I think it's foregone conclusion it was going to come sooner or later.
Yeah, I mean, everyone was wondering what took him so long, but of course, Biden's the only one left. I mean, who else?
Maybe, who knows? Maybe Michelle said, now's the time.
Michelle's running things in there. So I want to read a interesting article here from CNN.com talking about coronavirus. Here's the title. Governors on East and West Coasts form pacts to decide when to reopen economies. Now, before I get to this, do you remember in the last show when I was on the ledge a little bit,
I do
say
remember.
the least? Someone told me later, they're like, you just weren't having it, that show. And you're right. I had enough of a lot of things that day. But I played this cut here of Stephanie Rule from MSNBC. And this is her reaction to President Trump wanting to start an economic task force to get the economy going, correct? We talked about this. Here's what she said.
It's nearly impossible to do quickly, and simply saying, I'm going to put together a task force and we're going to be open for business. Let's make something clear. Open for business is a sentiment. It's a sign. It's not real life. This isn't a snow day. We're not going to decide a week from now or 3 weeks from now, all right, everybody trot back to work. Look at Singapore. Singapore opened back up, and then they saw the largest daily jump to date. And who was it? It was blue-collar workers. We're not going to go back to work until public health experts weigh in here, until you have departments of health say, where are we organizing the infrastructure to have wide-scale case testing, where every person who's showing symptoms has someone from the health department go to their house, record their case, figure out who they spoke to, who they visited. That's how you address this. You have to do it in a public health policy way, or we are going to be in worse shape than ever. And business leaders aren't going to do what the president tells them what to do. You brought it up first. It was Adam Silver from the NBA who said, we're canceling the rest of the season. That was the first moment we had this great aha shift. And it's those frontline workers, not necessarily people who are sitting in a C-suite, who are putting themselves at risk every day. So when you look at the unemployment number, it's upsetting and it's jarring. But it also means that Americans are going home, which is what we need them to do. And what the government needs to do is figure out how are we going to get, whether it's PPP loans or unemployment benefits, how are we going to get them to the American people faster? Because I promise you, as you just said, people aren't getting the money that they need, at least not yet.
Jeez, I forgot how long that cut was.
I was going to say, take a breath, my dear.
Jeez, whatever. So there you go. She's very upset, apparently, that Trump wanted to start an economic task force, right? Well, then I'm reading in the news today that states on the country's east and west coasts are forming their own regional pacts to work together on how to reopen from the stay-at-home orders each has issued to limit the spread of the coronavirus. The first such group to be announced came Monday on the East Coast. Democrat New York Governor Andrew Cuomo said his state, New Jersey, Connecticut, Pennsylvania, Delaware, Rhode Island, and Massachusetts, each plan to name a public health and economic official to a regional working group. The chief of staff of the governor of each state also will be a part of the group, which will begin work immediately to design a reopening plan. Okay, later on Monday, the West Coast states of California, Washington, and Oregon also announced they are joining forces in a plan to begin incremental release of stay-at-home orders. Governors of the three states will collaborate on their approach to getting back to business in a safe, strategic, responsible way, as announced by California Democratic Governor Gavin Newsom. The collaborative approach by governors on both coasts underscored the massive and complex calculations that the nation is facing as it looks to reopen the economy. Okay, so, why don't we hear from Stephanie Ruhle again on what these governors are doing? She should be really upset, right?
If you read between the lines of what she said was somebody other than Trump make the decision.
Oh, was that in there? I didn't hear that part. Yeah, I was going to say, let's go ahead and play the cut of her criticizing these governors, but wait, there is no cut up there?
No.
Tom Benson?
No, there's not.
So she wasn't on MSNBC blasting these governors for wanting to create an economic task force to reopen the economy? But I don't understand. I thought it was too soon. I thought there was no way it could happen. I thought it would be up to the businesses. I thought Trump was being blasted for even coming up with it on a national basis. How could he do it? He's risking lives. We want people to stay at home. That's what she said. Shouldn't she have the same reaction to these governors doing it?
Don't the governors know what the commissioner of the NBA said?
Yeah. We want them to stay at home, right? No, it's funny. I'm not hearing this from her. That's ironic. Huh? I don't understand why that would be. You think she would be consistent on this? Uh-huh. Now, what's really interesting, Tom, you'll like this. Mm-hmm. She did put out a tweet. Mm-hmm. It was actually a retweet, part of it. She put it out yesterday. Somebody else tweeted, Biden should name a shadow council to reopen America made up of healthcare experts, governors like Inslee, labor union officials, Elizabeth Warren, Bill Gates, etc. Stephanie Ruhle retweeted that and said, here's a thought.
Oh, my goodness. See? Anybody but Trump.
Well, I'm like, weren't you just blasting Trump for wanting to do this? Am I wrong? It was not that cut her blasting Trump for even thinking of the idea of doing this? Mm-hmm. Mostly because, it has to be done in these health officials, but we want people to stay home because businesses don't want to do it. And the Democrat comes up with an idea for them to do it. And she says, ooh, what a great idea. Why didn't anyone else think of that? Oh, wait, someone else did think of that. President Trump thought of that. I don't understand. It's just amazing looking at all of this. Okay, so in the next segment, later on in the show, we have to talk about Governor Ron DeSantis, our governor here in Florida, because his poll numbers are kind of low. He's getting blasted by the Orlando Sentinel and others for not being a good enough leader in this time of crisis. Because, he's the governor of Ohio is also a Republican. He closed schools on March 17th, and DeSantis didn't do it until March 20th.
Oh, my.
Oh, 3 days later. Oh, we're all going to die now. 3 days. So we have to talk about that. Also, an interesting article. I did an interview with someone on the Florida Roundtable that'll play this weekend who talks about why certain people might have worse symptoms than others when it comes to the coronavirus and COVID-19, the disease that comes from it. And it's something I had not even heard until today. And I'm thinking, why have I not heard this? This seems kind of important if this is true.
And it seems logical.
It seems logical, and it has policy ramifications. There could be a much smarter way of dealing with this outbreak. So we're going to get into that, a lot to get to on the show, and much more. This is Beyond Reason Radio. I'm your host, Michael Yaffe. We'll be right back.
This particular...
If you miss any of the show, you can download the Beyond Reason podcast on iTunes.
Talking about the coronavirus with children and teens can be overwhelming for caregivers. The Child Mind Institute has provided the following guidance to help alleviate some stress and anxiety. Don't be afraid to discuss the coronavirus. Be developmentally appropriate. Be reassuring. Focus on what you're doing to stay safe. Stick to routine and have ongoing conversations. Visit childmind.org for resources, support, and daily Facebook Live sessions with child psychologists. childmind.org.
Hey, it's Melissa Fox from Good Morning Orlando. Join me Thursday nights at 9 o'clock when I do my thing called Connection Show. It's relationship radio with a twist. We invite experts in the field to come and help us out with everything from relationship problems to health questions and more. Sponsored by Stages of Life Medical Institute in Longwood every Thursday night at 9 o'clock. Listen to the podcast on the iHeartRadio app. Search Connection Show.
I'm Nick Soboleski, a Select Quote agent with a true story that could save you hundreds of dollars a year. A woman named Linda just called. Her husband, Ray, has a $300,000 group life insurance policy, but is changing jobs and can't take it with him. Well, I shopped the many highly rated term life insurance companies we represent, like Prudential and Mutual of Omaha, and found Ray, who is 41 and takes medication to control his cholesterol, a 10-year, $500,000 policy for under $27 a month. That's almost twice the coverage for less than half of what he had paid. If SelectQuote hasn't shopped for your life insurance, you're probably paying too much.
For your free quote, call 800-589-5599. That's 800-589-5599. 800-589-5599. Or go to SelectQuote.com. Since 1985, we shop, you save.
Get full details on the example policy at selectquote.com/commercials. Or price could vary depending on your health, issuing company, and other factors. Not available in all states.
As schools close and we embrace social distancing, parents everywhere are struggling to keep children healthy and occupied. Consistency and structure are calming during times of stress, especially for kids. At the Child Mind Institute, top experts are coming together to offer free guidance about how to effectively support our children's well-being and our own during this crisis. Visit childmind.org for resources, support, and daily Facebook Live sessions with child psychologists. childmind.org.
Broadcasting from the Mills Air Studios. For all your AC needs, go to millsair.com to schedule an appointment. The voice of reason in a world that is beyond reason is back now.
Welcome back to the show. This is Beyond Reason Radio. By the way, you can follow me on Twitter at Michael Yaffe. You can also like the Beyond Reason Radio Facebook page. We are on Facebook Live right now. Just another way to catch the show. And, of course, if you miss any of the show, you can catch the Beyond Reason podcast anywhere that podcasts are available. So I did an interesting interview for the Florida Roundtable that will play this weekend. It plays on WFLA Saturday nights at 9 p.m. You can also catch the podcast of that in the iHeartRadio app. I interviewed a professor of sociology, Dr. Ann Hendershot. And we talked about an article she has in the American Spectator that I found fascinating, that I haven't heard anywhere else. Have you heard?
No.
We talked about this before.
Yeah.
Did you hear anything like this?
Not at all.
I find it amazing that this really hasn't come up. So here's the title. Coronavirus Dose Matters in the Demographics of Death. Now, what does that mean? Well, I'll explain it here. He says, it will surprise no one that the most recent demographic data released by New York City's Department of Health reveals that the city's elderly, those over 65 years old, make up 70% of all deaths from coronavirus in New York City facilities. As of last Friday, there were 1,584 coronavirus deaths in New York City. Probably a lot more now. This article's is about a week old. Males continue to dominate the demographics and yada, yada, yada. It goes over some of the other demographics as well. It says, by far, most overwhelmingly, the deaths are occurring among those with underlying medical conditions, including diabetes, lung disease, cancer, immunodeficiency, heart disease, hypertension, asthma, kidney disease, liver disease, and other. It says, this is the real story of coronavirus. Those without underlying conditions, including elderly people without underlying conditions, are highly unlikely to die. Ironically, it is more likely for younger people without underlying conditions to die of the virus than the elderly. While no one without underlying conditions has died under age 17, 8 individuals from age 18 to 44 have died, and 14 individuals without underlying medical conditions age 45 to 64 have died. This finding, because people are wondering, why would this be? Why would younger people who don't have underlying conditions be more likely to die than older people without those underlying conditions? Well, she goes on, she says, this finding can possibly be explained by the new research that reveals that viral dose matters. The level of the amount of virus a person is exposed to matters. So that means how much of the virus you're coming in contact with at one time, how much of it you're exposed to. It says here, according to a report in the New York Times by Joshua Rabinowitz, a professor of chemistry and genomics, and Caroline Bartman, a genomic researcher, the importance of viral dose is being overlooked in discussions of the coronavirus. It says in the article, as with any other poison, viruses are usually more dangerous in larger amounts. Small initial exposures tend to lead to mild or asymptomatic infections, while larger doses can be lethal. And I thought that was a really good example. So when it comes to different poisons, obviously, if you just come in contact with a little bit of poison, it's not going to affect you as much as if you drink a whole bottle of poison, whatever it is.
It's like Superman and kryptonite. A little makes him woozy.
Exactly.
A lot knocks him out.
Exactly.
Yeah.
And nobody is talking about that with this virus.
Mm-hmm.
So that would explain why New York City might be a lot worse off than some of the other places, because New York City is a lot more crowded, a lot more people in close quarters, and that means people are being exposed to a larger dose of the virus at one time than, say, in LA, where LA has a huge population. There's a lot of people there.
But it's spread out.
So people are coming in contact with the virus, but they're not coming in contact with large amounts of the virus at one time. So not many of them are getting the heavier symptoms and are dying, not as many as is happening in New York City. This could also explain why nursing homes are so much affected, not only because they're elderly and they have underlying conditions, but once again, you have a lot of people in a small space coming in contact with a larger dose of the virus. So when they're catching the virus, because they're catching it in larger doses, they are much more affected by it than people in larger areas.
By the way, New York State, as of this morning, had 10,834 deaths.
Yeah,
that's the
stunning.
state. That's the state, yeah.
And I thought this makes a lot of sense to me because New York City and LA and really Central Florida, the virus was spreading at the same time. You know, DeSantis even suggested that the virus started spreading in Florida after the Super Bowl. But LA was getting a lot of it at the same time. So why is New York City so much worse? It has to do with the dose of virus and the fact that when you're in crowds, and when I interviewed Ann this morning, she was talking about, you know, when you're on a New York City subway, you're literally face to face with tons of people in a small compact area.
Sure.
So the virus is spreading a lot more and you're getting a larger amount of the virus. You're being exposed to a larger amount of the virus.
Checking the hometown newspaper this morning, there's a retirement village up in my old hometown where I went to high school. They've had 5 deaths in this retirement village, 5. And in Seminole County, we've only had 2 deaths as of this morning. Again, you know, the concentration is there.
Exactly. But yet, our policy prescription for all of this across the nation has been to shut everything down no matter where you live. So in Seminole County, you're not going to be, as long as you don't go in these big crowded areas, you're not going to be exposed to that much of it. Yet they still want to shut down all of these things in Seminole County just like they would in New York City, even though we are finding out that new research says you're not going to be affected the same way in those same areas. Remember last week when I interviewed Amanda Prestigiacomo, and she was saying what she would like to see is us being more strategic. We combat this virus in different ways, in different areas, in different environments. Seems like when you look at the research, what she said makes a lot of sense. Now, she continues on in the article. It says, this has policy implications. Working in an office building that once had someone with the coronavirus in it is not as dangerous as dancing with the coronavirus infected person in the streets of New Orleans or for Mardi Gras or the beaches during spring break. And neither are as dangerous as spending time around severely ill coronavirus patients in an ICU ward. This helps us understand why young healthcare workers without underlying conditions are falling ill with the virus, and many of them are dying. So a priority does need to be to protect those healthcare workers because they really are putting their lives on the line because they're being exposed to a lot more of the virus, once again, in a small space in a hospital. And so, but we're having the same, so we all freak out in an office building when one person gets it. And we think that's the same as when you're like at a party and there's a lot more people and it spreads and people get worse, but it's not the same. And maybe we shouldn't treat it as the same if this is true. It says in China, more than 3,300 healthcare workers were infected, and including the doctor who died after being the first to alert the world of the pandemic.
I remember that.
More than 4,800 healthcare workers have been infected in Italy, and as New York City's hospitals become even more impacted, several ER physicians and other healthcare workers are reported to be in critical condition. It says we have to protect those healthcare workers and give them what they need. So that's one policy prescription here. But this is where it gets interesting. But for the rest of us, it is time to think about the policy implications of the fact that dose matters. It is possible to return to work at the end of our 30-day confinement, but with proper precautions, including masks, hand washing, and appropriate social distancing. Medical personnel will always face extreme risk and need to be protected. But for the rest of us, risk reduction measures should suffice, including mandatory mask wearing in congested cities like New York City, considering the fact that dose matters can make all the difference. I thought this was fascinating.
Yeah, yeah. I heard an interview this week from a guy who lives down, I think, Vero Beach. I'm not sure. But anyway, somewhere down there. He's back from the brink. And he said something that I didn't realize, and I'm sure it's the same way with a lot of hospitals. When hospital personnel go from room to room, they strip down and change.
That's interesting.
Yeah.
I guess it makes sense.
Yeah.
But it goes back to what this says. And no one is talking about this. I haven't, other than this article in the interview, I haven't heard this anywhere. That dose and the amount of virus you come in contact with at one time could matter how much you're affected by it. We need to look more into this because this could change how we respond to it. That's why this is important. So does Governor Ron DeSantis deserve all the criticism he's getting blasted by a lot of the media. He had really high approval ratings before this coronavirus, and now it's gone down. Does he deserve it? We'll talk about that next and more on this edition of Beyond Reason Radio.
If you heart Beyond Reason Radio, listen to the Beyond Reason Radio podcast on iHeartRadio. Just download the iHeartRadio app and search Beyond Reason Radio.
iHeartRadio is proud to join international advocacy organization Global Citizen to support One World Together at Home, a very special broadcast event supporting and celebrating healthcare workers on the front lines and the World Health Organization as they lead the fight against the COVID-19 pandemic with appearances by Billie Eilish, Chris Martin, Elton John, J Balvin, John Legend, Keith Urban, Lady Gaga, Paul McCartney, Stevie Wonder, and so many more.
Ready to do this.
Listen on iHeartRadio Saturday at 8 p.m.
If you're injured, you need to hear this message. All law firms are not the same, and the law firm you choose can make a huge difference. So how do you choose which firm to represent you? I'm Mike Morgan of Morgan & Morgan. Here's my advice. Do your research. Find the firm with the most experience, the best results, with the resources and track record of delivering exceptional service. As America's largest injury law firm, we have thousands of employees, unrivaled technology, investigators, experts, and an army of over 500 lawyers across the country. We are everywhere for everyone. We have the resources to take on the biggest fights and the biggest bullies. Last year alone, over 2 million people like you called Morgan & Morgan in their time of need. And our firm recovered over $7 billion for our clients. So after an injury, who would you choose? Results matter. Reputation matters. Choices matter. There's only one Morgan & Morgan for the people.com.
Dial pound law on your cell. Pound law, that's all. Offices, Orlando.
I'm Nick Soboleski, a Select Quote agent with a true story that could save you hundreds of dollars a year. A woman named Linda just called. Her husband, Ray, has a $300,000 group life insurance policy, but is changing jobs and can't take it with him. Well, I shopped the many highly rated term life insurance companies we represent, like Prudential and Mutual of Omaha, and found Ray, who is 41 and takes medication to control his cholesterol, a 10-year, $500,000 policy for under $27 a month. That's almost twice the coverage for less than half of what he had paid. If SelectQuote hasn't shopped for your life insurance, you're probably paying too much.
For your free quote, call 800-589-5599. That's 800-589-5599. 800-589-5599. Or go to SelectQuote.com. Since 1985, we shop, you save.
Get full details on the example policy at selectquote.com/commercials. Or price could vary depending on your health, issuing company, and other factors. Not available in all states.
For the smartest audience in talk radio, this is News Radio WFLA Orlando. Your voice of truth in a world of fake news. Beyond Reason Radio continues right now.
Welcome back to the show, everyone. This is Beyond Reason Radio. I'm your host, Michael Yaffe, the voice of reason in a world that is beyond reason. We are on until 8 p.m. tonight right here on News Radio WFLA Orlando. Don't forget you can listen to us on your smart speaker as well. Tell Alexa to listen to us, to listen to News Radio Orlando on iHeartRadio. So does Governor Ron DeSantis deserve all the criticism he is getting for his response to the coronavirus? Well, I'm going to say he deserves some of it, but not all of it. And I frankly am still very glad that he is our governor. Because all you have to do is look at what's going on in Michigan right now with the governor up there, who just did a mandatory stay-at-home order so strict that you cannot even visit another house in your neighborhood. So if you own another house or you want to go visit your brother and drive to your brother's house down the street, you are not allowed to, and you could face penalty for doing so. Not only that, but that's another one of these states where they're blocking you from buying non-essential items. I'm doing air quotes. You can't see it on the radio, but non-essential items in the store. There are a lot of governors out there that seem to be in a rush to take away our liberties. And frankly, Governor DeSantis has not been in a rush, and he's being blasted for it when really maybe he should be praised for it. But his job approval rating has gone down. I was reading this from the Orlando Sentinel. It says many governors getting a huge approval boost amid coronavirus response, but not DeSantis. So state governors across the country have seen their job approval ratings soar amid their handling of the outbreak, with one notable exception, Florida Governor Ron DeSantis. In a list of 15 governors' most recent approval numbers, compiled by the political statistics website 538, DeSantis was the only one to not see a double-digit improvement on his baseline approval from the end of 2019. DeSantis, who has been heavily criticized for his slowness in ordering the state shutdown and its many exemptions, as well as for the state's Byzantine unemployment system, Jesus Christ, actually saw. I just love when I read like editorials and stuff from the Orlando Sun. Man, it just seems like it's an awful place to live here in Florida. Like, why would you want to live in Orlando? It's so terrible. All the poor are just destitute. Oh my gosh. Except thousands of people are moving here every day. It seems like he actually saw his approval rating drop by 7 points where it was at the beginning of the year. Does he deserve this, though? Well, he is getting blasted for something he said a few days ago, where he was talking about possibly reopening the schools in May for the end of the year. And he was talking about this virus doesn't seem to affect young people as much as elderly people, which we all know. And he said this.
This particular pandemic is one where I don't think nationwide there's been a single fatality under 25. For whatever reason, it just doesn't seem to threaten, kids.
Governor Ron DeSantis taking heat.
Okay, so there you go. That is DeSantis talking about that there. And the fact is, he was wrong on that. That there is no evidence to say no one under 25 countrywide has died. There have been some that have died from the coronavirus, but none of them are in Florida. So he's being blasted for saying that when really there's only been there hasn't been any cases of young people under 25 dying from the coronavirus. And in fact, when you look at a lot of the stats, and we don't know all of the stats here, really it's very low across the rest of the country. So you just mentioned, Tom Benson, that how many deaths are in New York right now?
Almost 11,000.
Almost 11,000.
Yeah.
And yet the CDC reports on its website that 4 people between the ages of 15 and 24 and 1 person between the ages of 1 and 4 have died. CNN also reported on the death of a newborn in Connecticut on April 1st and an infant in Illinois last month. So you're talking very low amount of people young dying here. So DeSantis probably does deserve some criticism for what he said there. Probably shouldn't have said, no, you need to be more forceful. But it's not like he said that and we find out that thousands of young people are dying across the country. So that goes to my main criticism of DeSantis. A lot of people are criticizing him for not doing the shutdowns earlier. A lot of people are criticizing him for having exemptions for religious services in the shutdowns. A lot of people are criticizing him for not shutting down schools earlier and all of that stuff. I think all that's fine because, like I said, I don't want a leader who's in a rush to take away our liberties and take away our rights. Why Governor Ron DeSantis isn't doing this is because there's constitutional implications to all of this stuff. That being said, if you're going to stand up for our rights, stand up for them. Be more forceful in what you're saying. His one issue is when he does a lot of these press briefings and he talks to the public, he's not as forceful about it. He's kind of wishy-washy. Oh, we might do this. Oh, we might do that. Oh, I'm just not sure. And he doesn't exude as much confidence as I would like him to exude in a situation like this. Now, most of that is just perception. I get it. But the fact that he's being blasted for not doing a shutdown earlier, when maybe there was no need to do the shutdown earlier. As I was mentioning, this was spreading a lot, probably at the same time as it was spreading in New York City, yet New York City has a lot more deaths than the state of Florida has. So why are we doing a similar type shutdown in the state of Florida than we're doing in New York City? How does that make sense? It doesn't make sense to me. So Governor Ron DeSantis was actually on Fox News over the weekend, on Mark Levin's show, Life, Liberty, and Levin. And he actually made some good points on how we could combat this virus in the future and possibly reopen the economy. And he's being blasted. As I mentioned, his poll numbers are going down. But when I actually listen to him here, what he says makes a lot of sense. I like what he's saying here. Another reason why I'm glad he's our governor. Here, he talks about why we need antibody testing, which is going on now in Florida. Here it is.
So we're going to start testing for the antibodies. And I know that Stanford University is doing a very important study. You see different studies that have been done overseas. And I think that the consensus seems to be emerging, that whoever tests positive for it is probably just a small fraction of those who have actually had it. Because, of course, for people who are in the younger age groups, people who don't have significant underlying conditions, this could be something that is relatively mild symptoms. And so if you're somebody in Florida that had this in mid-February, you're coughing, have a small fever, most people probably didn't rush to the doctor at that point. Having the antibody test, I think, will be able to help us determine how widespread has this been. And of course, that will then inform what we do going forward, because the more widespread it is, then I think the less efficacy some of the lockdown policies will ultimately have.
Well, there you go. I think that totally makes sense. See, he's looking for solutions there to combat the virus, but do it in a strategic way so we're not totally devastating our economy. And I'm supposed to hate his response as the governor? I don't want a governor like they have in Michigan, where they're in a rush to take away our rights. I don't want that. Yes, I want them to deal with the crisis, but we have other things we have to worry about, like our constitutional rights and the economy, which I've been talking about for weeks on this show. Here's the next thing that he talks about here. Another way that we are combating the spread of this virus. And once again, this totally makes sense. Here it is.
Some of the things that have been done in Southeast Florida, we've worked with all those counties. You have seen really strong restrictions weeks ago there. But in some other parts of Florida where the caseload is much lower, you're still doing things to be able to contain the virus. We have an integrated public health system, so the county health departments are integrated with the state. And when you have an infectious disease in a place where, you may have 20 cases in a county of 150,000, the way to contain that's most effective is to isolate the people that have the disease and then trace their contacts and then see of the contacts who may have symptoms and then test them. And then that really has worked to help slow the spread. So Florida has been doing the contact tracing all throughout the state this whole time. Now, when you start getting into Miami or Broward, where you have more cases, the contact tracing, you're just going to be limited in how you can do. But there's definitely a lot of parts of Florida where that is still very effective. And we have a lot of professionals who do a really good job at it.
He's talking about contact tracing there. So instead of shutting down and quarantining everyone, which when you quarantine everyone, it's not a quarantine at that point. Quarantine is when you isolate people who are sick. We're isolating everyone. It's not the same thing. But he's coming up with a solution there, maybe in other parts of the state, where we could limit the spread of this virus without shutting everything down. I'm glad he's doing that. because other governors are not doing that. Other governors seem to be ratcheting up how many restrictions there are. And I'm worried about that. Now, coming up in the next segment, I'm going to play the voice of reason of the day when you're talking about civil liberties. Also have some Beyond Reason comments from, of course, AOC, or as I like to call her, this is Beyond Reason Radio. I'm your host, Michael Yaffe. We'll be right back.
Listen to the latest episodes of Beyond Reason. Download the podcast at Spreaker.com.
Earning a degree from UCF Online doesn't mean you have to live far away. In fact, in a national survey, 3 out of 4 online students said they live within 100 miles of their college. Regardless of where you are or where you want to go, UCF Online offers the in-demand degrees and student support you need to succeed. No wonder U.S. News & World Report ranks UCF among the nation's top online programs for undergrads. Learn more at ucf.edu/online.
I'm Nick Soboleski, a Select Quote agent with a true story that could save you hundreds of dollars a year. A woman named Linda just called. Her husband, Ray, has a $300,000 group life insurance policy, but is changing jobs and can't take it with him. Well, I shopped the many highly rated term life insurance companies we represent, like Prudential and Mutual of Omaha, and found Ray, who is 41 and takes medication to control his cholesterol, a 10-year, $500,000 policy for under $27 a month. That's almost twice the coverage for less than half of what he had paid. If SelectQuote hasn't shopped for your life insurance, you're probably paying too much.
For your free quote, call 800-589-5599. That's 800-589-5599. 800-589-5599. Or go to SelectQuote.com. Since 1985, we shop, you save.
Get full details on the example policy at selectquote.com/commercials. Or price could vary depending on your health, issuing company, and other factors. Not available in all states.
News Radio WFLA Orlando is available everywhere with the iHeartRadio app. Now #1 for podcasting. News Radio WFLA Orlando, an iHeart radio station. The place where we talk faith, culture, and politics. Beyond Reason Radio continues.
You know what this crisis is really pointing out, Tom Benson? According to some on the left, this crisis is really pointing out why capitalism is a failure.
Oh, really?
And why we need social. Yeah, you didn't know?
No.
No, you haven't noticed that, huh?
No.
I haven't really either, because it's a lot of private companies that have been helping us out during this, frankly. But yeah, apparently capitalism has just been such a failure here. At least when you listen to AOC or that's how it's, when you pronounce it the right way, it's So there you go. But AOC has been pointing out that this shows why we need to get rid of the profit motive in a lot of things. I kid you not, because of this coronavirus. Never let a good crisis go to waste here. Here's one comment that AOC put out on social media where she was talking about why we need Medicare for all, of course. And this is an example of it. Here it is.
Our public health system should be free at the point of service for every single person in this country. There are folks that are saying, you'll get paid sick leave if it's COVID-19 related. As we're seeing with Amazon, they'll take your fever. If you don't have a test, then you will not be paid, you will not receive paid sick leave. We should have universal systems where every person can see the doctor free of charge when they need to see it so that they can get the care that they need. That is what it means to live in an advanced and modern and humane society.
Wow.
Yeah, so we need to be like the United Kingdom, Tom Benson. Except here's an interesting article I found from the New York Times, that right-wing rag of a newspaper, the New York Times, talking about the United Kingdom and their healthcare system. Headline here: UK backs off medical rationing plan as coronavirus rages. So when you're talking about they back off, that means they had a plan of rationing. Very interesting. You mean not everyone gets all the care they need in a national healthcare system all the time? It says here, Britain has long offered public guidance on when to deny life-saving treatment, but has hesitated with the coronavirus. Many worry that decisions may harm the poor, the aged, and with people with disabilities. Denying life-saving care to conserve public resources is nothing new for Britain's National Health Service. It's funny, I don't hear that part in Democrat debates. Do you, Tom Benson?
No.
That they actually have to ration care? Very interesting. Here's another part. In expensive treatments for cancer and other diseases, the health service officially limits what it will spend to postpone a death. £30,000 or about $37,000 for each year of full quality life provided to a patient. In the case of a pandemic, the public guidance from health officials for more than a decade has been that doctors should prepare to withhold scarce resources from the weakest patients in order to save more of the strong, especially with use of life-sustaining ventilators.
That sounds like, to me, the older you are, the less you get.
And they're backing off of that because of a lot of the criticism. But doctors in northern Italy, another national healthcare system, have already reporting withholding life-extending support from patients in order to devote scarce ventilators to those with better odds. I keep hearing how America's failing at this, but the other countries are doing so much better in response to this. Except Italy actually let people die because they didn't have enough resources. We haven't heard of stories here in the U.S. of all places. That's not happening. People are not having to make those decisions in the U.S., believe it or not. And where are they having to make those decisions? Oh, in the socialized medicine countries, the nationalized healthcare. Oh, but AOC says it's the solution to all our problems. Okay, sure it is. Now, she also said another thing. We were talking about the Defense Production Act.
Yes.
Remember a couple of weeks ago, basically forcing companies to make things, kind of nationalizing them? AOC said this.
For some reason, we have an enormous problem with enacting the Defense Production Act for saving lives and guaranteeing healthcare. Now that, I think, that points to a much deeper problem with the systemic priorities that we currently have in the United States. But it's never too late to change it. We must organize to change those priorities from our budget to our production. We have to start demanding and organizing from the bottom up, from grassroots movements, from nurses to warehouse workers to grocery store employees to the halls of Congress, demanding that we strip profit motive out of our decisions and reprioritize the public good and the health of everyday people.
Yes, see, we have to get rid of the profit motive because it's so evil. We need to reprioritize everything for the public good. You know who else said something similar to that? I believe Stalin probably said that a couple of times. Maybe. I mean, it's like straight out of these communists.
What are the Marx brothers they don't talk about? Carl.
Yeah, exactly. Like, come on. They just think socialism is going to solve all our problems. No, it's going to make things a lot worse. So why don't we get to the voice of reason of the day? Judge Andrew Napolitano. Sometimes he's been a Trump basher. I don't agree with everything he says. But when it comes to this, he makes a great point about our civil liberties and them being taken away. And they shouldn't be. The Constitution doesn't just go away right now. Here's what he said.
You know, one of our colleagues sent me a cartoon of the framers signing the Constitution. And in this cartoon, Washington turns to Madison and says, let me get this straight. None of this counts if people get sick, right? You know, sort of a humorous way of mocking what's happening today. Your analysis of Governor Whitmer could apply to nearly all the remaining 49 governors who assume that they have the power to crush individual liberties, violate the Constitution, and write laws. Well, they don't. Laws in this country are written by legislative branches after public hearings and debates, so there's a transparency. So we would know why she doesn't want you to buy garden hoses. There'd have to be a rational basis articulated for it. But when the executive branch takes upon itself the role of not just enforcing the law, but of making up new ones, and when in the process it crushes basic fundamental liberties like the right to travel and the right to worship, never mind on Easter Sunday, but on any time you want to worship, we are witnessing the slow death, the death in slow motion of civil liberties, because these governors, these petty tyrants, will use this power again and again until some courageous federal court or an outraged public stops them. Hopefully it'll be outrage stirred up by the type of reporting that you and some of our colleagues have begun to be doing. And even some of our colleagues on the left have been doing some of this reporting. But basic human liberties are guaranteed in the Constitution. They can't even be taken away by the vote of a legislature, much less the command of a governor or a mayor. These executive orders look like orders and sound like orders. They're just guidelines. They don't have the force of law. There cannot be a criminal sanction for the failure to comply with them, because they are at their root just the whim of those in power, intended to enhance their power. Yes. They are not valid expressions of constitutional doctrine.
Now, he's talking about something there. He's exactly right. He's talking about something there that I've been talking about for weeks now, and it's really the precedent that this sets. We have now given governors and mayors and the president a lot of power. We've given the government a lot of power to take away your liberties very quickly when they deem it necessary in a crisis. And even if it's somewhat necessary now, they are going to try to use it in the future, and they are going to say the same things. Oh, it's a crisis. And we have to make sure to push back on some of this. And one person who pushed back, by the way, was a federal judge who blocked the Louisville Mayor Greg Fisher from forbidding drive-in church services on Easter. This is what the judge said. Very interesting. You'll like this, Tom Benson. An American mayor criminalized the communal celebration of Easter. U.S. District Judge Justin Walker wrote in a temporary restraining order issued Saturday. That sentence is one that this court never expected to see outside the pages of a dystopian novel, or perhaps the pages of The Onion. The mayor's decision is stunning, and it is, here it is, and it is beyond all reason unconstitutional. Judge Justin Walker might be a fan of this show. I'm just saying, but he said blocking churches from having drive-in services on Easter is beyond all reason. Because it was totally unnecessary. Is this about stopping the spread, or is this about just showing your authority and saying you're in charge during a crisis? I think it's about the latter. It's a power grab, unfortunately, in too many cases. Appreciate you listening to the show. If you missed any of the show, catch the podcast anywhere that podcasts are available. Listen, you can also like the Beyond Reason Radio Facebook page. It's on there as well. And I will be back tomorrow at the same time. See you then.